Alright, so today we will be doing a range of motion breakout for knee extension. So I'm going to have the patient lay supine on the table. The end feel should be firm, and the normal range of motion is going to be 0 degrees. The landmarks that we're going to be looking for is the fulcrum to be the lateral epicondyle of the femur, and the proximal arm will line up with the greater trochanter, and then the distal arm will line up with the lateral malleolus. Now we're going to have the patient have a towel underneath their Achilles tendon. I'm going to also apply this bolster because I want to make sure that the area underneath the knee is not touching the table, so that way I have my room to feel the proper range of motion of knee extension. I will feel for
wrist up, wrist down. Don't tell me.
Feel for lateral.
Oh, can you go up like this? And come all the way back down. Okay.
Now I will apply pressure both to inferior and superior part of the knee.
And feel good. Good.
It has 1 degree of knee extension, should be 0, so she has slight hyperextension in her knee. We're going to be testing range of motion of thoracolumbar lateral flexion. How we're going to be doing that is putting the fulcrum at the S2, and the proximal arm will be facing perpendicular towards the ground, and the distal arm will be facing towards the T1 of the patient. The normal range of motion is 35 to 38 degrees. There is no really active end feel that we're going to be feeling for, and I will show you that we already pre-marked T1 and S2 on the patient. However, if you want to find S2, you simply find the patient's PSIS.
Okay. Now what I want you to do is say,
and then move medially, and it's right there where I have that marked. And then find the patient's T1. I would feel for the bony prominence of C7. I would ask her to flex her neck. I feel it coming to my hand. Ask her to extend, and then I'll go one spinous process under that. Ask her to flex again, and extend, and it should stay right there. So that's her T1 right up there. So I want to place the fulcrum at S2, and then I will also place the distal arm, bring the proximal arm facing downwards, and the distal arm facing her T1. So now I will stabilize the left hip, actually lateral flexes to the right. Once she can't move any further, I will now move this arm towards the mark that I have up here. I can take it off. She has 14 degrees of range of motion, so definitely under the 35 within normal, but that's how she is. So she's definitely hypomobile with the thoracolumbar flexion. So today we've been performing a manual muscle test for hip external rotation. I'm going to have the patient laying supine, testing grades 0 through 2, because the patient could not do the anti-gravity position of grades 3 through 5. So, which will be having sitting at the edge of the table, and I'll be testing them in the anti-gravity position. So, I'm gonna have the patient lay down in supine. So what I'm gonna be feeling for is for the greater trochanter, and asking for the patient to perform the range of motion. If they can go through the full range of motion, that'll be grade 2. If I can only feel a muscle contraction, that's it. It's grade 1. And if I feel no muscle contraction at all, it's a grade 0. First. Okay, so please perform external rotation. So since she was able to perform it, I'll give her a grade 2. Some compensation to look for is possible abduction of the hip, especially in the gravity minimized position. But since she was able to perform it, I'll give her a grade 2, and she's good. So we're going to be performing a manual muscle test for hip extension. So what I'm going to have done is the patient lay prone. Now, normally with hip extension, I would have asked the patient to lift the leg straight up. However, since this would be a glute max bias for the hip extension, I'm going to ask the patient to then bend their knee and lift their leg up. I will stabilize the hip, as well as put my hand toward the distal end of the hamstrings, and then apply pressure. 3 degrees of my force. So she was able to buckle under pressure. It's around moderate pressure, so I would say it's a 4. Some compensations you want to look for is excessive lumbar lordosis. as well as any possible pelvic tilt. And since she was able to hold the position and resist my force, that's why she was doing well in the anti-gravity position. But if she wasn't able to even hold the position, I would put her in a gravity minimized position, which would have her laying sideline as I would support her leg, and then she would perform hip extension and see if she can go through the range of motion.